Thoracic outlet syndrome. Thoracic outlet syndrome can be subdivided into neurogenic, venous, and arterial types, depending on which structures are compressed in the interscalene triangle or costoclavicular space. Neurogenic thoracic outlet syndrome is the most common and often the most difficult to diagnose and treat effectively. Patients most often present with supraclavicular and anterior chest wall burning pain and with segmental pain and paresthesis of the arm in an ulnar nerve distribution. Weakness of the intrinsic muscles of the hand is not uncommon. Thenar or hypothenar muscles wasting is rare. There is usually a history of whiplash trauma, motor vehicle accident, fall, assault, or repetitive activity of the upper extremity, word processing, filing, particularly overhead activities like lifting. Physical examination will often disclose supraclavicular tenderness and positive brachial plexus tension testing. Adson test, positive Adson test, and a positive roots test, and or a positive tinal sign proves there is the disease neurogenic thoracic outlet syndrome. Adson test is obliteration of the radial pulse on inspiration while turning the head away from the affected side. And positive roots test is reproduction of symptoms with a rapid opening and closing of the hand with the arm 90 degrees abducted at the shoulder and 90 degrees flexed at the elbow. Positive tinal sign is tingling in the distribution of the nerve produced by tapping in the supraclavicular interscalene region. Physical therapy is the treatment such as the Edslow neurovascular entrapment self-treatment, ENVEST, capital letters, Edslow neurovascular entrapment self-treatment program, beginning with breathing exercises and attention to posture. Transcutaneous electrical nerve stimulation, TENS, is often helpful. Surgery may be indicated in severe refractory cases and involves resection of the hypertrophied anterior and middle scalene muscles, brachial plexus neurolysis, and resection of the bony abnormalities. Venous thoracic outlet syndrome involves external compression of the subclavian vein by the first rib, anterior scalene muscle, clavicle, and costocoracoid ligament. COSTOCORACOID. Costocoracoid ligament. A history of repetitive upper arm exercises or clavicular fracture is common. Positional venography is essential in the diagnosis of venous thoracic outlet syndrome. Thrombosis of the involved vein segment is known as Paget-Scrotter syndrome. Paget Scrotter, SCHROETTER. Paget-Scrotter syndrome or effort thrombosis and often presents as acute unilateral arm edema, axillary fullness, hand cyanosis, and enlarged shoulder and chest wall collateral veins in an otherwise healthy patient. Treatment of symptomatic venous thoracic outlet syndrome involves anterior and middle scalenectomy, 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 and first rib resection with venolysis, which can performed through a supraclavicular, a combined supra and intraclavicular, or a transaxillary approach. If the vein is thrombosed, multimodality therapy is employed. Preoperative thrombolysis followed immediately by surgery with intraoperative angioplasty of any residual venous stenosis. If the vein cannot be recannulated preoperatively, surgical thrombectomy may be required. The prognosis is excellent with appropriate treatment. Third one, arterial thoracic outlet syndrome is the least common of the disorders and involves compression of the subclavian artery between the anterior and middle scalene muscles. It most often produces subclavian artery aneurysms which result in digital ischemia due to atheroemboli. Arm claudication is a less common presentation with Willi-Allen test performed by exsanguinating the arm with elevation, occluding the radial and ulnar arteries at the wrist, and observing capillary refill of the hand when these arteries are released. May reveal occult digital artery occlusions that can be confirmed by angiography. Treatment involves removal of anterior and middle scalene muscles and a resection of the aneurysm with polytetrafluoroethylene interposition graft. Thank you.